Victoria is now facing 6 months of Andrews' state of emergency, the Andrews government state of emergency. The extension legislation, as I said, passed through the upper house in Victoria overnight with support from some of the state's senior medical professionals against the Premier. So it's not support, against the Premier. Now, in a letter, 13 of these medical practitioners outlined their concerns with the government's pandemic response, and they noted it's our professional opinion the Stage 4 lockdown policy has caused unprecedented negative economic and social outcomes in people, which in themselves are having negative health outcomes. Let's bring in two senior Victorian politicians, Liberal Senator Sarah Henderson and Nationals leader in the Senate, Bridget McKenzie, both from Canberra. Thanks for your time. I'll start with you if I can, Sarah. I mentioned at the top of the show they needed a gag at 2 a.m. in the morning to ram this through. It's hardly a good look when we've got these doctors in the media today disputing the Chief Medical Officer's advice, calling for a bit more sense and concerned about, the broader health consequences of these lockdowns.
Well, absolutely, Peter, and good evening. The doctors pointed out that some 11,000 people every year die from cardiovascular disease and 10,000 from cancer compared to the number of COVID deaths. So I think the concerns that have been raised are quite legitimate. But more broadly, I think Daniel Andrews' extension of 6 months is demonstrating to Victorians that he does not have a proper plan in place other than to continue to lock down the state. This is doing extraordinary damage, economic damage. It's costing $400 million a day. And of course, the mental health consequences that we've spoken about before, Peter, are absolutely profound. And I have to say, these are very, very dark days for Victoria at the moment.
Let's have a listen to some of the commentary from the Parliament last night.
How can I be assured that over the long term that these benefits outweigh the harms? This is something that I've questioned repeatedly about in other opportunities I've had to do this, and I haven't been satisfied that the harms are very well understood. How do you seek assurance on this?
Bridget, there's been a lot of complaint, how quickly this was brought on in the Parliament, the lack of debate, the lack of briefing. I mean, he has had months and months and months. We know the Parliament has not been sitting to develop this plan, to put it into the Parliament. Many are saying that he should have actually had the plan to come out of the lockdown first and then sort these sorts of extensions.
Look, Peter, it's incredible, isn't it, how the response to COVID-19 is rolling out in our home state of Victoria. We've seen the tragedy of the quarantine and the contact tracing, the disastrous decisions around border closures, his failure to shut down those original 12 local government areas in Melbourne that were recognised hotspots swiftly and securely. And we're now all dealing with the terrible consequences. And as Sarah said, socially, economically, and with the terrible health impacts. And thank goodness we've got doctors in Victoria who are prepared to put their names to a public document to stand up for what is right and to stop this politicisation of what should be a swift response from the state government. Parliaments are important, particularly during times of crisis, as we're seeing. And for regional Victorian MPs to be able to head to Spring Street to tell of the stories and to actually hold the government to account and to come together is an important part of getting through this crisis together.
I'm going to play a grab of a speech from my former boss, Tony Abbott, last night in London. He's talking about, in the absence of a vaccine, we need to have a debate about how we might live with this virus, protect the vulnerable, but also start to open up our economies. Let's have a listen.
Now that each one of us has had 6 months to consider this pandemic and to make our own judgments about it, surely it's time to relax the rules so that individuals can take more personal responsibility and make more of their own decisions about the risks they're prepared to run.
That comment there, Bridget McKenzie, goes to, I think, some comments you've been making for some time. We can't have a one-size-fits-all when it comes to Victoria. You're in a border community. We know we've got states like South Australia, WA, Queensland with almost no transmission. We've got to be a bit more nimble here, particularly when you see those national account numbers today.
Well, absolutely, and the former Prime Minister makes that point really well overnight with that speech around the health impacts of our response and how that they can be equally as negative or if not worse. And we're living with that, not just in the Victorian-New South Wales border, but right around the country as city-centric premiers drunk on almost political polling numbers rather than relying on medical advice about shutting down their borders and, in our case in Victoria, stage 4 and stage 3 restrictions, which are having a terrible toll. See, when we talk about economic impact, we're actually talking about people's jobs. And right now in border communities, you can't get to work, you can't open your business. We've heard all of those terribly inhumane stories of the health impacts. It's just been horrific. And 120 years ago, Peter, we became one nation together, and we shouldn't be doing this to each other right now. We should be able to have a sophisticated, nuanced approach to this pandemic.
Yes, I did note the Queensland Premier allowing all the footballers and the football executives to cross the border today, and a woman lost her twin, one of her twins. We know she was on the border in Ballina only last week. I mean, I just can't believe it. Sarah, I'll go to you on this point because there's an economic plan, they say. She's calling that, certainly, the Premier, Anastasia Palaszczuk, but it's been slammed by Queensland's Chamber of Commerce and Industry as neither visionary nor detailed, more of a rehash of old announcements. Now, Victoria is looking to see a plan on Sunday. I'm concerned about places like the Great Ocean Road. You know it well. How does it open up for tourism come summer and do it safely, or we're going to be pushed by Daniel Andrews into locking down the state and making it really tough for businesses to survive?
Well, Peter, there is absolutely no doubt that there is profound concern, and I've had phone call after phone call today from businesses in the Geelong and Great Ocean Road region really worried about how the Victorian government is going to reopen the economy. As Josh Frydenberg has said, this is probably the worst public policy failure that we have seen from a state government in history. Not just the hotel quarantine disaster, but the disaster with contact tracing. Essentially, the Victorian government really has lost control. They have not got a sophisticated system in place like New South Wales, where they're managing the hotspots properly. And so this whole approach of shutting down the state is really based on very poor public health premise and, of course, so damaging. And the other concern is now that if regional Victoria is opened, then everyone from Melbourne will swarm to regional Victoria, including the tourism hotspots. And then that will be out of control, and we'll have the other situation occurring where we have mass crowds. So, look, I think the bottom line is Victorians have lost so much faith in Daniel Andrews' capacity to manage the coronavirus pandemic. And again, we still have not seen any sort of roadmap, and that is eating into the huge dissatisfaction from Victorians.
I just want to mention something I discussed. I just want to move on to something, if you don't mind, Bridget, because last night, in a phenomenal response, both on Facebook and on this show, I had your colleague, Minister Tudge, on talking about a bill before the Parliament to stop people in detention who are about to be removed from Australia, many of them criminal, from having phones if those phones are being used, you know, to pass around illicit information. We know about child pornography and other things. Let's have a listen to the Minister last night.
They failed to realise, Peter, that now 70% of all of the people in the immigration detention facilities are actually people who are being kicked out of the country because of a serious criminal record. 70%.
So we have these cases, Bridget. We see the detainees, we're told, Border Force see them with their phones, with child pornography material, distributing it. They cannot access those phones. They cannot confiscate phones. They can't search for illegal drugs. You're trying to change that with a law in the Parliament, and Labor say they will not support it. Why?
I mean, it's just incredible. The Labor Party wants to be the alternative government in this country, and your number one job as a government is to keep your citizenry safe. So when faced with the bald-faced facts that these people are using their mobile phones to transmit illicit information, to delete key information that could assist our law enforcement agencies to find corroborators, etc. For Labor to actually be refusing to support us to give those powers to Border Force so they can actually act in a timely fashion, which is one of the issues that is just abhorrent and just shows once again they're more interested in playing cheap political tricks than actually behaving like an alternative government, because that means making the tough decisions to keep Australians safe.
How can anyone take Christina Keneally seriously? I mean, she's one of your colleagues in the Senate, Sarah Henderson, if she's backing in the criminals and the pedophiles like this.
Well, it is appalling, and of course this law means that for the first time Border Force officers will be able to seize mobile phones and other internet-capable devices, which frankly are being used for things like planning escapes, potentially terrorism, criminal conduct, and other heinous crimes, including child pornography. I cannot understand that Labor is again refusing to back this bill and leave not just the Border Force officers powerless, but also make it really unsafe for those working in detention centres, but also other detainees. This is, again, very, very poor judgment from Labor, and I really do condemn Labor for its stance on this bill, Peter.
Yeah, it's extraordinary, extraordinary. If the election had gone the other way, running Home Affairs right now would be Christina Keneally.